Today we're going to be talking about meningitis. Let's see. Okay, this is our objectives. After this presentation, the learner should be able to meet the following objectives with a score of at least 85% on the quiz. They should be able to understand the different types of meningitis, identify any risk factors that may increase chances of contracting meningitis, recognize signs and symptoms of meningitis, identify appropriate diagnostic studies and tests used, and understand treatment plans for those affected with meningitis. Meningitis is an acute inflammation of the protective membranes covering the brain and spinal cord, known as the meninges. It can be classified as bacterial, viral, parasitic, fungal, or non-infectious. In premature babies and newborns up to 3 months old, common causes are group B strep, usually passed from the mother to baby during delivery, and bacteria that normally inhabit the digestive tract, such as E. coli. Other children are more commonly affected by Neisseria meningitidis and Streptococcus pneumonia. In countries where vaccination is not offered, children under 5 are commonly affected by Haemophilus influenza type B. Adults are commonly affected by Neisseria meningitidis and Streptococcus pneumonia, or pneumococcal meningitis. Together, they both cause approximately 80% of bacterial meningitis cases in adults. Pneumococcal vaccine has lower rates of pneumococcal meningitis in both adults and children. Skull trauma causing nasal cavity bacteria to enter the meningeal space can cause staphylococcal meningitis. Staph meningitis can also be caused by those with impaired immune systems. Tuberculosis meningitis is more common in places where tuberculosis is endemic, but also common in persons with weakened immune systems, such as those with AIDS. Some viruses that cause viral meningitis include enteroviruses, the herpes simplex virus, the varicella zoster virus, the mumps virus, and HIV. Fungal meningitis can occur in people who use immunosuppressants, patients who are HIV positive, and can also be related to the decreased immune function associated with aging. The most common fungal meningitis is cryptococcal meningitis, which is the most common cause of meningitis in Africa. It accounts for 20 to 25% of AIDS-related deaths in Africa. Parasitic meningitis is often related to a predominance of eosinophils in the cerebrospinal fluid. Some of those are Angiostrongylus catecholaminosus, Gnathostoma spinigerium, and Schistosoma. Meningitis can also be caused by other non-infectious factors. Malignant or neoplastic meningitis is caused by the spread of cancer to the meninges. Also, certain drugs such as NSAIDs and some antibiotics may cause non-infectious meningitis. It may also be caused by inflammatory conditions such as neurosarcoidosis and disorders such as SLE. All right, a little bit about the history of meningitis. Some authorities suggest that the realization of meningitis dates back to 400 BC by Hippocrates, who's also known as the father of Western medicine. In 1768, Robert Witt described dropsy in the brain, which was linked to tuberculosis meningitis nearly a century later. In 1805, the first recorded major outbreak of meningitis occurred in Geneva, Switzerland. Several other epidemics in Europe and the United States were described shortly after. The first report of an epidemic in Africa appeared in 1840. African epidemics became more and more common throughout the 20th century. The first time the bacterial infection was linked to meningitis was in 1887 by Anton Weichselbaum. He was the first to describe the meningococcus. In 1906, anti-serum was produced in horses, which was developed further in 1913 by the American scientist Simon Flexner, who began treating bacterial meningitis with intrathecal meningococcal anti-serum. And just FYI, intrathecal, because I wasn't sure what that was, is administration of medication into the spinal cavity. In 1944, penicillin was reported to be effective in treating meningitis. In 1993, the introduction of the Haemophilus influenza type B, or the HIV/Hib vaccine, led to a fall in cases associated with this pathogen. And in 2002, evidence emerged that treatment with steroids can improve the prognosis of bacterial meningitis. It's estimated that approximately 25,000 cases of bacterial meningitis occur annually in the United States. Approximately 9,000 cases of viral meningitis occur in the United States, and altogether approximately 850 cases a year result in death. Here's some risk factors associated with meningitis. Age is an important factor. Infants are at a high risk for bacterial meningitis. Also, as mentioned earlier, the decreased immune response associated with aging can increase the risk of contracting meningitis. The community in which a person lives may also have an impact on the risk of contracting meningitis. Infectious diseases tend to spread more quickly where larger groups gather. For example, college freshmen living in the dorm rooms, military personnel are at an increased risk. Certain medical conditions can also increase the risk of meningitis. There are certain diseases, medicines, and surgical procedures that may weaken the immune system or increase the risk of meningitis in other ways. As mentioned before, diseases which people are immunocompromised, such as HIV and AIDS, can increase the risk. Also, those who undergo certain surgeries or procedures are at risk, such as those having sinus surgery, cranial surgery, or lumbar punctures. They're also at risk for the bacteria being introduced into the meninges. Working with meningitis-causing pathogens such as microbiologists who are routinely exposed to meningitis-causing pathogens, they're at an increased risk. Also, people who often travel at risk. Travelers to the meningitis belt in sub-Saharan Africa may be at risk for meningitis, particularly during the dry seasons. Also at risk are travelers to Mecca during the annual Hajj and Umrah pilgrimage, which is when millions of Muslims gather to worship, and that's considered the largest annual gathering in the world. A lot of people there get infected with meningitis. Alright, at this time, I'll pass it over to Jessica Boyd, who's going to talk about some pathophysiology.
My name is Jessica Boyd. I'm going to talk about pathophysiology. Most cases of meningitis are caused by an infectious agent that's colonized or established a localized infection elsewhere in the host. Potential sites of colonization or infection include the skin, the nasopharynx, the respiratory tract, the GI tract, or the urinary tract. The organism invades the submucosa at these sites by circumventing host defenses. Okay, there are three major pathways of invasion: through the bloodstream, the neuronal pathway, direct contagious spread. Next, we're going to talk about injury, disease, process, and effect. All good? Advanced bacterial meningitis can lead to brain damage, coma, and death. In 50% of patients, several complications may develop in the days to weeks following infection. Long-term sequelae are seen in as many as 30% of survivors and vary with etiologic agent, patient age, presenting features, and hospital course. Patients usually have subtle central nervous system changes. Common signs and symptoms. You're going to have fever, malaise, headache, stiff neck, photophobia, phonophobia, nausea and vomiting, decreased level of consciousness, and confusion. Along with fever, you can have cold hands and feet. It's real easy to mistake early signs of meningitis for the flu. Meningitis signs and symptoms may develop over several hours or 1 to 2 days. Signs and symptoms are different in adults than they are infants and children. Newborns and infants may not have the classic signs and symptoms of a headache, stiff neck. They may have a high fever, they may have constant crying, excessive sleepiness, or irritability. They may be inactive or sluggish. They may have poor feeding. They may have a bulge in their soft spot in the fontanelles, and their body may be stiff. Okay. Common signs and symptoms that affect the body. You have hearing loss, cortical blindness, other cranial and nerve dysfunction, paralysis, muscular hypertonia, ataxia, seizures, mental motor retardation, focal paralysis, subdural effusions, hydrocephalus, or cerebral atrophy. Meningitis is swelling of the membranes around the brain and spinal cord. There are different types of meningitis, but most are caused by viruses or bacteria. Viral meningitis can make you very sick, but it often does not leave lingering effects. Bacterial meningitis is more serious. It progresses rapidly and can cause permanent damage or even become life-threatening. A quick diagnosis and treatment can help prevent some of these potential long-term side effects. If you have symptoms of meningitis, see your doctor without delay. Anyone can get meningitis, but it's more common in babies, children, and adolescents. It also affects your central nervous system, which is made of the brain, spinal cord, and nerves. Meningitis is an infection that causes the protective membranes of the nervous system to swell. Inflammation of the brain and spinal cord can affect every part of your body. Fever and other symptoms can come on suddenly and progress very quickly, causing devastating effects. Headache can be an early warning sign of meningitis. Residual headaches may be a problem for some time. Inflammation of the brain may cause a wide range of problems, including cognitive issues and seizures. Trouble with the memory and concentration may last well after the illness has passed. Children may be left with lingering learning difficulties. Next, it can affect your circulatory system. As bacteria multiply in your bloodstream, they may release toxins. Septicemia is a life-threatening condition. Bleeding under the skin starts off looking like a mild rash. A blood pressure falls and circulation slows. Blood vessels become damaged. The rash spreads and darkens to a deep red or dark purple. The lungs and the kidneys may deteriorate, and poor circulation puts the fingers, toes, arms, legs at risk for amputation. Diagnostic testing may include analyzing the blood for evidence of bacteria. If hospitalized, intravenous fluids, steroids, or antibiotics may be given as a part of your treatment. The next, it can affect your skin. With the onset of fever, your skin may look flushed, and then if the septicemia sets in, your blood vessels can become damaged. It also affects your skeletal and muscular systems. Stiff neck and back are common in meningitis. It may become difficult to turn your neck or to even turn it at all. The head, neck, and spine become painfully rigid and arched. Babies and young children are more likely to experience this than older people. Joint stiffness may continue long after the illness clears up. Viral meningitis may improve without treatment, but bacterial meningitis is serious. It can come on quickly and requires prompt treatment. Delaying treatment for bacterial meningitis increases the risk of permanent brain damage or death. In addition, bacterial meningitis can prove fatal in a matter of days. It is also important to talk to your doctor about undergoing a spinal fluid testing. You may need to take medication to prevent an infection. To prevent an infection if you have been around someone that has meningitis. Next, I'm going to turn it over to Bailey McDonald Smith.
Alright, I'm going to talk about some diagnosis and prognosis of meningitis. Early diagnosis and treatment is very important. If the meningitis disease is suspected, samples of blood and central spinal fluid are collected and sent for testing. It's very important to catch this disease early on because if you treat it immediately, then there is more likely to have no long-term effects, as if you wait a little while and then seek treatment, then you're more likely to have more serious side effects long-term. The way you can, if you come in presenting with symptoms of meningitis, they'll run some tests such as blood cultures to check infection in your blood. They might do a lumbar puncture to obtain some central spinal fluid. They'll do x-rays, CT scans to check for infection, and it will be sent to the lab for see if there's any growth. And depending on the growth and what bacteria strain you have, the doctor will diagnose with some specific antibiotics that will target that bacteria and treat the infection. Viral meningitis cases usually last 10 days or less. They're less severe and not as deadly as others. Some cases develop rapidly, resulting in death within the first 48 hours, despite early treatment. Some short-term effects include behavioral, emotional, and psychological problems. You can have fatigue, headaches, maybe some hearing loss, and sleeping problems. Some long-term effects include the same things: behavioral, emotional, and psychological issues, fatigue. You also might have some neurodeficits, but this is more common with pneumococcal meningitis, not with viral. You can also go to www.meningitis.org/impactedmeningitis to see these effects to do more research on the effects that meningitis can have on you long term. Effects that meningitis have on the individual and the family. It can affect multiple organ systems. You definitely need some support from your family. It risks spreading infection are real common, so your family needs to be well educated on what they need to do to take precautions from getting the disease. But you want support from your family. You don't want to feel isolated. You might have hospitalization, which is a strain on the family and on the income. Insurance usually isn't a big problem because it's a medical diagnosis. And for support groups, there's not many support groups out there, but you can go to www.meningitis.org/helpingyou, and there are some resources there to reach out and get more information and more support from other people. Alright, now I'm going to turn it over to Haley Bonner, and she is going to talk about nursing diagnosis and plan of care.
A few things for the nursing diagnosis. This would be some things that would go for the meningitis. I'm just going to go over a few of them. Most importantly, the risk for infection transmission related to contagious nature of organism would be one of our most important nursing diagnoses for this disease. Secondly, it causes a lot of pain, so pain would be, a top priority. Acute pain related to headache, fever, neck pain, secondary to meningeal irritation. Altered mental status related to swelling of membranes around the spinal cord. Impaired physical mobility related to intravenous infusions, nuchal rigidity, and restraining devices. Activity intolerance related to fatigue and malaise, secondary to infection. Risk for impaired skin integrity related to immobility, dehydration, and diaphoresis. Risk for injury related to restlessness and disorientation, secondary to meningeal irritation. Interrupted family process related to critical nature of situation and uncertain prognosis. Number 9, anxiety related to treatment and risk of death. And a last one for this would be risk for ineffective therapeutic regimen management. For the top nursing diagnosis, this would be, the plan of care we would give. Number 1 would be risk for infection transmission. This is very important with meningitis. We want to get that antibiotic started immediately. That would be our priority. Also implement isolation precautions. Hand washing is always important, and patient hygiene is important also. Acute pain. With meningitis, you are in severe pain, so we would want to check the patient's pain level frequently, administer pain medications as needed, provide comfort measures, and we would also want to assess for nonverbal signs of pain. Another important nursing diagnosis would be altered mental status. So some interventions for that, we would want to do some frequent neuro checks on the patient. Let's report any changes in neurostatus to the physician and assess for headaches, because headaches can be a warning sign for an altered mental status change. Another nursing diagnosis would be impaired physical mobility. Interventions for that would be to turn your patient frequently to prevent breakdown, assess the skin for any type of breakdown or wounds, and if they did already get to the stage of wounds, you would want to provide wound care as needed. Our last important nursing diagnosis would be activity intolerance. Some interventions for this, you would want to provide active and passive range of motion for the patient. Physical therapy would also be beneficial to them. Occupational would be good. And we want to promote the patient's independence as much as possible. These are our list of sources, and we will also post the quiz to the discussion board, and a copy of the PowerPoint will also be sent in. And this concludes our PowerPoint. Thank you.